Right, everyone, we'll start the event now. So first, I would like to pass on a welcome from the board and the chairperson, Vasan Srinivasan, who's joining us today as well. And I'd also like to thank them for coming along to this event. So welcome to this event today. We begin by acknowledging the traditional owners of the land from which we are all meeting on today. In particular, I would like to acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional owners of the land from which I'm meeting you today. And I likewise encourage everyone to take a moment to reflect on whose land you are on during this call. We pay our respects to their elders past, present, and emerging, and I extend this same respect to any Aboriginal or Torres Strait Islanders who may be joining us here today. I would also like to welcome Professor Peter Barlis, who is our speaker for this event, alongside Mike Hudden, who will be speaking later in the event. So Peter Barlis will be presenting on the topic of physical health matters. He is a director on our board of directors at the Mental Health Foundation of Australia. Peter is an internationally recognised interventional cardiologist with the Northern and St Vincent's Hospitals in Victoria, and Professor of Medicine with the Faculty of Medicine, Dentistry and Health Sciences at the University of Melbourne. After graduating from the University of Melbourne, he completed cardiology training at Austin Health, followed by a Master of Public Health with Monash University. In 2006, he secured a fellowship and scholarship at the prestigious Royal Brompton Hospital, London, and then completed his PhD at the Thorax Centre, Erasmus University, the Netherlands, on the use of optical coherence tomography in cardiology. OCT harnesses the properties of infrared light to look inside blood vessels in ultra-high resolution. Peter has since overseen OCT's uptake across the region, with over 60 centres in Australia and New Zealand benefiting from his foresight. He is internationally renowned for his interventional and imaging academic output and early development programs for novel therapies in cardiovascular disease. He has maintained connections all over the globe and continues to attract industry support for his research. He runs an active research group in biomedical engineering focused on coronary imaging and computational modeling, with an interest in the development of innovative cardiovascular technologies. Please welcome Professor Peter Barlis to speak with us all today. Professor, I will just ask if you could.
There you go. So
thank you.
Thank you very much. I hope you can all hear me now. So it's a privilege to be here with you all. And as a representative, of course, of the Mental Health Foundation Australia, as a board director. And today's topic is all about physical health matters. And I, being a cardiologist, still obviously with a lot of heart problems, and I want to give you a little bit of an overview of heart disease and what it represents, and how it potentially links up with mental health. And what are some of the tips and tricks coming from a cardiologist that you might be able to implement in your own life to actually improve physical health. So I'll just share my screen, and hopefully you can, I'll just share my screen now. Okay, so hopefully my slides are coming out.
Your slides have come up, yeah.
Fantastic, thank you very much. So, as I said, I work, my day-to-day job is as a cardiologist, and of course the heart being a major organ in our body that feeds blood pumping at 70, say, times per minute to support nutrients and oxygen throughout the entire body. So again, my focus has been on the heart, and I want to also tie in how the heart relates to the brain and the mind. So it's a very, very important relationship that I'm beginning to understand more and more with my role as the Mental Health Foundation Australia Director. But just a bit of an overview, I think is important to acknowledge that cardiovascular disease still is the #1 cause of death and disability in our community. And again, it really touches many of us in society and has an impact beyond just what it does on the heart, but of course on the mind as well. It's usually a chronic condition, and there are several risk factors that we know are linked to developing cardiovascular disease, namely diabetes, high blood pressure, high cholesterol, smoking, and genetic factors that can predispose us to developing these complications of heart disease. In essence, what happens with heart disease is that it affects the arteries of the heart, and blood flowing in the arteries, we get this process known as atherosclerosis, and this cholesterol causes narrowing in our arteries that limits blood flow and causes complications. So that is the major condition that we have to address in our society in Western world. What I do as an interventional cardiologist, and Ellie gave a nice introduction as to what I do, I 24/7 might be on call if a patient is having a major problem with their heart or a heart attack, and we find that they have got a blockage in an artery. Well, I will go in there and place a stent, which is a little spring that acts to open the artery and restore blood flow, relieve symptoms, and therefore improve well-being and improve survival for the patients with this condition. But of course, the heart does not work in isolation. And I sort of see this lovely infographic here of the heart being at the centre. Of course, it's the centre of my universe as a cardiologist, but it's the centre of our mind and our bodies. And it's in our mind, and there is a direct link with what happens to our heart and what happens in our mind. And therefore, we can do to physically improve our heart health will go a long way to improving our mental health and well-being. But there's no doubt there is a direct correlation with heart disease and mental health. And we know, for example, that cardiovascular disease is more common with those people in the community living with depression compared to the general population. We know that depression itself is a considerable risk factor for developing coronary heart disease, along obviously with all the other risk factors that we mentioned. There is also potentially a link with anxiety, but the direct correlation is yet to be established conclusively. However, we know that those suffering depression are also more likely to suffer anxiety. So you can see all these conditions can cause other problems to develop. For example, if we're suffering from depression, we may not be able to look after ourselves as we should. Our diet may not be as good as it should. We may not be having the irregular exercise that we need to protect our heart, to protect our minds. And it's common, as I said, it's a common condition. You can imagine when you've opened up an artery, patients had a heart attack and they're developing severe chest pain, and then they've survived that, they're doing well, they go home after day 3 or day 4. They're left with these worries, these concerns and these fears about how this has impacted their life and what impact will it have on their future, the future of their families, on their job. These are all real factors. So we can't only focus on the heart in isolation. We've really got to focus on the entire body, and the mind is central here. We know, as I mentioned, that patients with heart disease and depression are often less motivated to look out for themselves, to follow daily routines, to eat appropriately, and to exercise. They're also more prone to going to cigarettes, going to increasing alcohol intake. So very important we try to establish and address these links and target them to optimize overall health. There are many symptoms that we may feel, and of course it's very common that we have many of these symptoms: the heart racing, jumping, fluttering, feeling nervous, unable to breathe, chest pains, poor sleep, but it also has an impact on our mood and behavior. Our love may pick up that we have changed, in fact. And we are feeling physical symptoms. We are feeling physical symptoms that I see as a cardiologist on a daily basis. But the best thing that I feel I can do is investigate to make sure there's nothing underlying this, and to be able to work with the patient, to reassure them, to say that the heart is all well, pumping normally, and that we can control these symptoms. And improving physical health is one key way we can achieve this. So Again, we don't assume that all symptoms are purely based on a condition affecting our mental health. We've got to screen, we've got to look at underlying causes as to why these symptoms may be there. Is there any physiological cause that's contributing to this? Is there any hormone imbalance? How's the heart pumping? Is the heart function normal? There are several things we need to evaluate before we can conclude that there's nothing seriously wrong with the heart. But how does this tie up with physical health? And I think this is the key aspect here that I want to focus on today. Physical health, by definition, means how well is our body functioning and having enough energy to perform our daily activities, to get up in the morning, to brush teeth, to get ready for work, or in Victoria's cases, to remain at home for work. But again, that's equally another challenge. Working from home causes other stresses in our life. So again, this is what physical health is. It's how our body functions and do we have enough energy to support our daily needs. Having a high level of physical health, we know, significantly improves the way we feel. Allow us to tackle every stresses in a far more informed fashion. We can also avoid injuries. For example, trips and falls. Well, if we've got good optimal physical health, that means that our muscles are appropriately strong enough to support our body, minimizing risks of breaks in the bones and so forth. And I like to look at this, and you may have heard about this, called the health triangle. And here we talk about health not only being one aspect, but health actually means looking at improving health, improving our energy to allow us to achieve what we want to achieve in our life. And it measures all aspects of wellness: physical, psychosocial, and mental health. And this is really, really the key. The health triad, the physical, the family and psychosocial, and of course the mental and the emotional health. All these are critical in the way we optimize our overall well-being. And to achieve optimal health, we must pay attention to all of these three individual aspects of the triangle. If we focus on only one or only another, we will have an imbalance. We need to acknowledge that all these aspects are intertwined and interconnected. And it's important, again, to having an optimal balance in all those three aspects. And I know it's difficult sometimes when we are suffering conditions, when we are feeling the pain of mental health and conditions affecting us there. But we need to strike a balance between all those to improve our quality of life. Now, I want to bring up a new concept here with you all, and I hope that you can provide some feedback to me, because for many decades that I've been working as a doctor, I've seen the importance of physical health, and I've seen it working in hospitals. For example, if you have a fracture of your knee, what do you do after your fracture? You go to rehabilitation. If you break your hip, what do hospitals do after day 3 or day 4? They discharge you to a rehabilitation service to get you to have exercise and physical therapy, knowing how important these are to actually improve our overall well-being. So again, this is important in orthopedics, post a fracture, for example. Equally, with heart, we do the same thing. We have what we call a cardiac rehabilitation program that every single patient who comes in under a cardiology hospital admission will be referred to a cardiac rehabilitation service. And that includes a lot of education, but includes a lot of physical health, physical improvements to optimize muscle activity, minimize body weight, body fat composition. We do that for orthopedics. We do that for cardiology. And you can see even in cardiology, the Heart Foundation has a great fact sheet on cardiac rehabilitation. So you have a condition, you have your initial treatment, and then you always go and have rehabilitation. But what about this vision here? What about having a mind wellness rehabilitation program? And I think this highlights to me that we've got to diffuse the stigma associated with mental health and mental illness. It's a condition. It's a condition that affects us physically. So therefore, there must be strategies for us to improve outcomes following an episode of mental illness. And I like to think about it being a rehabilitation program, to rehabilitate our minds, to get stronger and better. So health and wellness, what does it all mean? Well, we know regular physical activity can do much to prevent disease. It makes us feel better. It makes us look better. We have better posture. We have better mechanics. We can perform better at work. And we know that if we're physically active, we are less likely to be depressed. We are more likely to socialise, to interact with other people. And we know that these are critical factors in improving our overall physical and mental health and well-being. So we know health-related activities. Well, we know they can include cardiovascular fitness, aerobics, the ability to exercise and increase your heart rate, and that therefore improves overall fitness of your heart and improves your lung capacity. You're able to get more oxygen, improves, but also your muscles improve. Strength training is also another factor. Going into the gym or even some home weights at home, some exercise bands. And by doing that, that actually stresses the muscles and actually causes the muscles to enlarge and to get stronger, thereby supporting our bones, our ligaments, our tendons, and making us also feel stronger within ourselves. That improves muscular endurance. It improves flexibility. But it also, and more in particular for my practice in cardiology, where I do see a lot of obesity issues, it can improve the body composition and reducing fat. That has a number of benefits at reducing our blood pressure, reducing the risk of diabetes, and therefore our overall well-being. Now, what does exercise and what does physical activity do? It gives us this feeling of elation or euphoria. It reduces anxiety, and these are proven tips here. It reduces the burden of depression. It improves our ability to cope with stress. It raises our self-esteem. It improves our mood. Importantly, also, it improves our sleep. Sleep has become a major issue. No doubt, of course, in the pandemic, but mental health and the sufferers typically might have disturbed sleep or inability to sleep. And you can imagine what happens with one night or 2 nights or 1 week or 1 month of poor sleep. We become tired during the course of the day. Our cognition is affected. These have major impacts on our mental health. Exercise actually causes more nerve cells to activate. It increases neural activity. And there is a complex constellation of things that exercise does. It actually increases production of certain neurotransmitters, releases serotonin, dopamine, norepinephrine, melatonin. And I see it as a fertilizer for the brain. So again, think about it like that. Think about it as a way to actually improve the physiological hormonal changes in our body that can have a great impact on the way we feel. Now, what are some examples? And I get a lot of my patients to say, Dr. Barlis, what can I do? I want to be more active. Well, exercise can be in the gym. You may be in the gym, you can do weights in the gym, you can do fitness equipment. That's one form of exercise, but it doesn't have to be that. You can attend a class. Exercise in a yoga class, and that gives you the added benefits of being able to communicate and interact with others who might be in the same class. It can be as simple as going for a walk. And that's what I like to say, that a simple thing about going outdoors and going for a walk can have a significant impact in the way we feel. Not only does it make us feel better, we get exposed to fresh air, but there are also benefits on our body, on our skin, on delivery of vitamin D. Vitamin D being an important hormone in our body that's important in the way that we metabolize calcium and bone strength. So again, there are several benefits. You don't have to go to the gym. You can go out and about. You can exercise at home. Exercise bands. There are a lot of strategies in place that can improve our overall physical activity. I also like to think about fitness trackers. Fitness trackers, there is definitely proven data to suggest that fitness trackers do make us more informed about how we're travelling with our fitness levels, how many steps. And again, I encourage my patients to try to achieve an increased number of steps. Now, how many steps, as said Dr. Barlis, and you hear the magical 10,000 steps that you should be doing, but you just do more than what you did last time. That's the simple way you can approach it. More than what you did last time. Off at a low rate, aim for small increments, increasing from 5,000 to 6,000 steps to 7,000. Going out and about will make a significant impact in the way we feel and also improve our overall heart health as well. We must not forget nutrition. And again, I encompass this as part of physical health because it's important that we have a balanced diet. Again, many of the questions that I get asked is, how do we tackle our diet? How can we lose weight, Dr. Barlis? And what can we do about this? And there are many fads out there. There are many. And again, they can equally be effective, but simple things are simple. What we put in equals what we put out. So if we're putting in a lot more than we're expending in terms of energy, then obviously weight will be a problem. Our diet needs to be balanced. It needs to have all aspects of fats, carbohydrates, and proteins. We need nutritious meals so we can actually sustain over time. There's no point in Dr. Barlis prescribing you a lettuce diet for 1 week. Of course, kilograms. However, the problem is that that is not sustainable. Water, 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 water. Now, how many of our participants out there are actually drinking enough water? Now, we say 8 cups of water, 8 to 10 cups of water a day. Dehydration over a long time can actually cause problems in itself. It can cause us to feel thirsty, but it also can cause our heart to have to work a bit harder to pump more blood around to ensure that oxygen is delivered. So blood pressure struggles, the heart might become you might develop palpitations, you might develop symptoms. And it's amazing what drinking water can do to our body. Sleep. We talk about how much sleep. 7 to 8 hours sleep is typically a minimum requirement. And sleep is where a lot of our recovery happens physically in our body, but also mentally in our mind. Being refreshed for the next day is important. So we set ourselves with new challenges to actually be able to accomplish them. If we're not having the sleep, we're feeling more tired, we're not eating right, we might skip breakfast because we're running late, and then we go into a bit of a vicious cycle. So engaging in some type of physical activity is important. Maintaining healthy body weight. Again, doing that through an assessment of what we're taking in, but also trying to increase the amount of activity we're actually doing. And avoiding substances. Again, a key problem here. Tobacco, drugs, alcohol. They have an impact on not only mental health, but I see it as a cardiologist and the impact that we see with heart disease, with cholesterol building up in arteries, and smoking is one of the key factors there. So as we said, sleep is very, very important if we can achieve this. And again, it can be difficult, but seek advice, seek assistance, and that's important. Don't ignore sleep and not being able to sleep appropriately. There might be conditions that limit you from sleeping. There might be snoring. There might be conditions such as sleep apnea that impact the amount of oxygen getting to our body overnight, so we're not feeling refreshed. We wake up with a headache. We need to take a nap during the course of the day. These are symptoms that you need to discuss with your local healthcare professional for further advice. And the human body does like regularity, trying to go to bed at the same time, day in, day out. It's amazing how the body clock works. So again, I've got a list here of many, many self-care measures, and obviously we can't ignore these. Rest is important. Rest helps our recovery. Well-balanced diet. Avoiding caffeine, avoiding substances that we talked about, but trying to improve and increase the physical activity. And again, whether it's a gym class, whether it's walking in the park, whether it's in a swimming pool, getting out and about, whether it's just walking and monitoring yourself on a fitness tracker. You did 5,000 steps yesterday, I'm going to do 6,000 today. And I make it 7,000 in a week. 8,000 in 2 weeks. In a month, I'll make it to 10,000. That will have a significant impact in the way we feel within ourselves and improve physiology as well. Spend ample time with family and friends. I know it's difficult during this COVID period, but again, engage with all the electrical options that you have, Zoom and Skype and so forth, to really keep connected, because we all feel an element of being unconnected, disconnected when we have this period of isolation. So communicate with loved ones, with family and friends, but also seek advice, seek assistance from your local healthcare professional. So good health, to summarise here, is overall a product of many factors. We know that many of these control, and we talked about the triangle of the psychosocial, the mental and the physical aspects combining and interconnected to improve our overall health and well-being. We know that the benefits of physical activity are several, and they have positive influences not only in the way we feel, but also in our heart function, at lowering risks of developing heart complications in the future. It improves our joints, improves our strength, and makes us feel better. And again, I really want to use as a tool to think about as a mind wellness rehabilitation program. Anyone suffering from mental illness, there are several parts and areas that you can actually seek help from. But remember that do not forget the physical aspects to improve our recovery overall. As a cardiology initiative, what I've set up is a new YouTube channel. I'm new to this, but we're starting off with a Heart Matters channel to go into simple information about how we can optimise heart health, but overall well-being. So again, if you're interested in that, please feel free to log on to the website, and you'll get more information on that as well. And again, just to leave you with a big thank you. It's been great to be here, and I look forward to answering some of your questions. Thank you very much.
Thank you so much, Professor Peter Barlis, for that. It was very informative and great always to talk about those links between physical health and mental well-being, which really are so interconnected. Now, I will move, yes, thank you. I will move to introducing our next guest. I'll just quickly get our PowerPoint up on screen for you all.
Can I just say, whilst you're doing that, I'm looking at some of the comments that have been made, and I'm amazed. You know, I mean, it's fantastic. People have got their own strategies of dealing with this, their podcasts, and that's a great thing. A great comment here. Podcasts and listening to that engages you. Listening to, rather than music, having this engaging conversation in the background. So it's fantastic to see the great comments that are coming across. Thank you all for sharing. It's wonderful.
Yes, certainly. And I'll definitely second that. And we'll definitely dive more deeply into some of those comments as well in our Q&A panel shortly. Before we move on to that section, however, I'd like to now introduce Mike Hutton-Squire, Executive General Manager of Health Services at Australian Unity Independent and Assisted Living. So Mike joined Australian Unity in 2009 and became Executive General Manager of Health Services in 2018. Mike's prior experience has been as a senior leader in both the UK and Australia across multiple industries, including legal, finance, public relations, technology, insurance, aged care, pharmaceutical, and healthcare. In 2015, Australian Unity established its mental health service to treat anxiety and depression for people having experienced a recent hospitalization. Now, nearly 60% of participants have recovered from their symptoms after having completed the program. Mike and his team are committed to evidence-based interventions that are proven to work and support people leading their best lives. Please join me in welcoming Mike to speak.
Hi everyone, thank you for that introduction, and thank you also to Peter for your commentary. I think that that health triangle is a really great way to describe the various elements that that look after a person's whole well-being. And your second comment around mental rehabilitation, I think, is very much needed in terms of learning skills and capacity to self-manage rather than being reliant on the healthcare system to look after an individual's mental health. So both really great points. Good afternoon, all of you, and thank you so much for joining. I'd like to start by acknowledging the traditional owners of the various lands on which we're meeting, and I pay my respects to their elders past and present. I also want to offer my condolences to those who have lost family through the COVID-19 pandemic, and my thoughts go out to those families. The work that the Mental Health Foundation of Australia does is really quite incredible. It is their 90th anniversary, which is a tremendous achievement and a testimony to their commitment to mental health causes. This is Australian Unity's second year of involvement with the foundation, and we look forward to tackling those challenges of social issues together. Mental Health Month is held in October each year, and it's our opportunity to raise awareness about mental health and well-being and promote activities and ideas that can have a positive impact on our lives. Today, I'm going to be speaking with you about the linkage between physical and mental health. There is clear evidence that physical illness is more common in people with a mental illness. Some of the factors that cause this relate to lifestyle and socioeconomic elements, but also the challenges that people with mental illness face in how to access physical healthcare. The health system still looks at these as fairly separate conditions. And the outcomes are very stark. International studies report reduced life expectancy in psychiatric patients by 20 years for men and 15 years for women. People with the highest levels of self-rated distress are 32% more likely to have died from cancer. Depression's been found to be associated with an increased risk of coronary heart disease, as Peter has said. Schizophrenia is associated with double the risk of death from heart disease and 3 times the risk of death from respiratory disease. So this chicken or egg scenario, where we look to understand if the mental health has caused the physical health or vice versa, probably can't be fully answered. But regardless, it shows the need that we need to treat someone holistically. Last week, the budget announcements again substantially increased funding in a broad range of mental health services. And there's been a lot said about the need for increased investment, but also increased reform of mental health in terms of the sector. And the Productivity Commission's final report into how health services can be optimized will be hopefully released soon. But it would seem that at the current rate of spend, utilization, and unmet need, we find ourselves in a somewhat fundamentally unsustainable position in terms of mental health. Of particular interest in the Productivity Commission's report will be how the linkage between physical and mental health is addressed through these reforms. Either way, we need more workforce if we're going to address the greater health concerns, the mental health concerns. We need innovative ways to increase the supply of mental health professionals, as it takes at least 6 years to train a psychologist, and a psychiatrist it takes much longer. As much as we have this surge in mental health, we also have this severe shortage of workforce to meet these needs that funding alone will not solve. In terms of this year, the outbreak of COVID-19 is widely known to have long-term and profound impacts on Australians' health and well-being. For physical activity, the evidence shows a rapid worldwide step count decrease during the pandemic as one measure. In the study, there was a 27% reduction in step count just during the period pre-pandemic to current. So if that's any indication about how people's physical activity levels are decreasing through lockdowns and through restricted movement and social distancing, it does indicate that there is a very material impact. Further to this, antidepressant prescriptions have increased by 30% within the year. And this is what I call the physical and mental health seesaw. As physical activity goes down, mental ill health goes up. And despite the severe economic impact that we will feel because of the pandemic, it's perhaps the mental and physical health impacts that will be felt much greater and potentially for much longer as these unhealthy behaviors become entrenched in our lives. So what's Australian Unity doing to improve the nation's mental health? Well, for a long time, we've recognised the importance of high quality mental health support services. In 2015, we conducted a global search and we adopted the UK's NHS model of low intensity behavioural therapy called Improving Access to Psychological Therapies. We worked with Flinders University and we contextualised it to Australia. And we also adapted it for clients that have come straight from hospital. So that was a big difference between the UK model and ours. So we're dealing with people who are more acute that have actually been hospitalised. The program is now directly addressing the challenges with increased healthcare costs by enabling people to recover in their own home and stay recovered. And perhaps, Peter, I might go so far as this is going down the road somewhat of mental rehabilitation as it's delivered in the home and it's teaching lifelong skills for somebody to maintain their independence. Results from our mental health intervention have shown really encouraging results, and we've been published in a peer-reviewed journal as evidence that nearly 6 out of 10 participants who enter our program showing signs of mental ill health have recovered from those signs. So the evidence is important because in the Australian healthcare context, it's really critical that we provide linkage between primary care and acute care. And really what we need is this national model of stepped care between the various clinical settings to ensure that Australians don't just bounce in and out of the healthcare system, but they actually develop the skills that they need to self-manage their mental health that last their lifetime. Also, from a workforce perspective, the program that we operate can train qualified mental health coaches in 12 weeks, and we can have them operating at a full caseload within 6 months. So this really goes to scaling the mental health workforce and ensuring that the increased demand for services is actually met by people who can help. Our coaches also assess an individual's physical health challenges and see what's going on in terms of their physical health condition. And if appropriate, we then enroll them in our physical behavior change program. And this program really addresses underlying chronic disease risk. It looks at improving modifiable risk factors such as exercise, sleep, nutrition, medication adherence, etc. And we can now demonstrate a clinical change in the person's clinical physical measures, as well as those patient-reported improvements of their health. And we've been just demonstrating our ongoing commitment to the mental health and well-being of Aboriginal Australians and communities as well. And we've recently invested in another mental health program for low-intensity behavioural therapy that we've called Healing Minds. And this initiative is jointly developed by Australian Unity's Indigenous Services business and the Remedy Healthcare business. And it leverages our existing experience in mental health service provision and Aboriginal home care. And we launched this program just a couple of months ago in July 2020. And using Flinders University's behavioural science team, we will be analysing it and looking to see the level of improvement we can make for people's mental health in Indigenous communities. And then we plan to adapt it for culturally and linguistically diverse communities and assessing their needs and supports. In closing, the Mental Health Month is our really important opportunity to raise awareness about the impacts of mental ill health and the range of supports available that can improve someone's well-being. It is especially true for culturally and linguistically diverse communities and Indigenous communities who we know are at higher risk for mental health concerns. And really, we must maintain a focus on adopting services and programs that are grounded in evidence and have long-lasting, meaningful impact to people's mental health. In particular, it's important that our healthcare system is looking at the individual's entire well-being, not just mental or physical. Holistic health assessments should be the gold standard in triaging and service design. We commit to continue our work with the Foundation to identify service gaps and develop these culturally appropriate mental health services. And this is, as always, is an important and exciting partnership that we think can add value to what we do as individual organizations. And I really thank the Foundation for their unwavering commitment to improving better mental health for all Australians. And my thanks to all of you for joining today. Thank you.
Thank you so much for that, Mike. Yeah, really great to hear kind of both of your reflections and the way they kind of merge together quite well in this consensus that we're kind of coming to here about the importance of that connection between mental health and physical health. We'll now move on to our question and answer panel with you both. The first question that has come up is, and this is directed at Professor Barlis. If you have a diagnosed cardiac arrhythmia, what precautions do you need to take?
Well, a cardiac arrhythmia, well, look, just to give you a bit of an overview of what is a cardiac arrhythmia, essentially means that there is a disturbance in the way that the electrical supply of our heart is working. Whether it be that it becomes too fast and you get these symptoms called palpitations or flutters, and these can go very, very fast, can become very uncomfortable. One of the more common conditions that you may have heard in the community is one called atrial fibrillation, which is an irregularity in the pulse rate. But look, again, the same principles apply to any heart condition here. The same things with cardiac arrhythmias, where we experience these palpitations or flutters. The key symptom that I see that makes my patients feel worse is when they're not drinking enough fluid. A lack of fluid intake. And as I said, water, water, water. Amazing what it can cure. And there you go. And as you're sipping your water. Caffeine, we know, can have a direct stimulating effect. So caffeine can be useful in our mind to help pick us up a little bit. But again, when you start consuming too much caffeine, that can directly stimulate the centers on our heart that cause extra heartbeats to occur. And that can then cause more symptoms. Sleeplessness or sleeping poorly can have an impact on increasing arrhythmias. And other conditions such as snoring or sleep apnea can also impact on that. So again, hydration is important. Alcohol reduction in those cases there, again, we find that these arrhythmias or the atrial fibrillation is commonly seen in an emergency department on a Saturday night after people have gone out for a bit of a binge, a lot of alcohol, and bang, the heart goes into this irregularity. So again, simple principles, optimal hydration, but of course with any specific condition, please do see your own general practitioner for further advice.
Yeah, certainly. And you mentioned alcohol there. We do actually have a question in the comments regarding, is there a scientific basis to avoid alcohol? For example, catching up with a best friend over one glass of wine or something like that.
Sure. Look, alcohol, again, I'm not saying here, I'm not advocating there's no alcohol, zero alcohol. We're all, again, looking at the context of alcohol in the form of our social gatherings, family, enjoying a glass of wine or two, absolutely fine. It's the excess that causes problems. There is definite evidence that in chronic consumption of alcohol over many, many years, that has significant impact not only on the liver, that's a separate issue. Me as a cardiologist tends to see the issues affecting the heart, where the heart becomes weaker, the heart becomes enlarged, the heart stops working as efficiently as a pump. So that's a chronic abuse of alcohol over a long period of time. But again, you know, enjoying alcohol socially, responsibly, no questions whatsoever. So long as we're balancing everything else, ensuring that we're optimizing our hydration and optimizing our physical activities and not engaging in other at-risk behaviors such as smoking or drug use, that they're critically important to avoid those.
Certainly. The next question we've got that's come up in the chat that both of you might have something to speak to on is, how can people keep healthy and fit when the medications used for their mental health cause weight problems, exhaustion, headaches, etc., which impact on their motivation, self-esteem, and motivation plus ability to exercise?
Yep. I mean, Mike, you would also see that in your field as well, you know, with a lot of the clients that you look after with these chronic conditions who are on many of these medications. And I totally understand that many of these medications that we do use for mental illness can cause increasing weight gain, can cause elevated cholesterol levels. And of course, they then translate into feeling more depressed. And again, it's a vicious cycle. So it can be challenging, but I never say anything is impossible. We've always got to say, acknowledge that it is going to be more difficult. The medication is essential to treating your underlying condition, but it's going to be more difficult, but it's not impossible. We can still achieve it. Again, seek advice from your general practitioner, from your therapist who is prescribing these. The aims are obviously to have as low a dose as possible, to ensure that we're monitoring them. And there are some that can affect the heart more so than others. So there are certain tests that may be useful in those situations. But again, it's a matter of getting that motivation, making that initial decision that I'm going to go out today and I'm going to go and walk for 5 minutes. Because in the media, we typically say you've got to go out there for an hour of walking. People don't engage in that. That's very, very difficult to adhere to. Going out for a 5-minute walk is what I set my patients a target. Start off with 5 minutes. That can be achieved. Doesn't matter what medication you are on, that can be achieved. Start off with small steps and build it up over time.
And I might just add, you know, what we see, I mean, we see tens of thousands of people through our programs every year, and many of them have built up almost a lifetime of medication because various chronic diseases, usually comorbid with more than one chronic disease, and as they have sought medical advice, they've built up this, what I would call a library of medication that they are on, and in many cases, this sort of incremental medication is somewhat of the problem, because they don't often stop and go back to their GP or their primary physician and say, can we look at this whole thing end to end and what's happening, because this isn't working with that, etc. Very, very few of our customers have that natural help-seeking tendency. And so they've built up this, as I say, this library of medication over time, and often they can be very counterintuitive for each other, and so medication reviews are really, really critical. It's something we encourage everybody to do, to make sure that individuals are on the right medication for the right condition at that time in their life, being the third really critical element.
Spot on, Mike. And I think there are so many advances with medication that I think it's important that once you've been on something, to always have that medication review, because there might be something better, newer, better tolerated with less side effects that may be more relevant for you.
Certainly, these are all very incredibly important points. And yeah, as someone with a few chronic illnesses myself, I definitely understand where you're coming from, Mike, with that statement of a medication list building up. It does do that very easily. So for anyone who's viewing today, if you haven't reviewed your medications recently, maybe this is a good reminder to do that sometime soon. All right, so our next question is for Professor Barlis, but I imagine Mike will also have something to say on this as well. And it's, do you think we should spend more time focusing on our mental and social health? And do you think that we often think of health as mostly just physical health and the only type of health that we consider? And how can we become more aware of our mental health and the importance of this?
Yeah, look, absolutely. It's a great question. And unfortunately, I guess the first time we ever think about health is when something unhealthy happens. And that is the problem here. Unfortunately, we are typically reactive and not proactive with our health. So again, things are going along well, the machine is working, it's pumping fine, no issues, don't worry about it, you know, until something goes wrong. And then we become more aware, and then we become very, very aware as to what's going on and how we can optimize it. And then there might be a sense of guilt or feeling that you've let yourself down, you've let your family down by not attending to something sooner. So I like to think about being proactive rather than reactive. Of course, we need to focus on, I mean, again, it comes back to the stigma, doesn't it, Mike? The stigma of mental health and mental illness. And it's something that we don't want to talk about. We don't want to bring up. But here, this is the forum, this is the opportunity that we have to sort of say that, This is an enormous problem, has a major bearing on our physical and health and well-being, and we've got to be talking about it. We've got to be openly discussing it, and openly, as health professionals, seeking to solve the challenges and not let it continue to be a major problem that it is. So I'm just passionate about that, because it's important that we do not ignore one aspect of that triangle for the sake of another. And in medicine, we've typically done that, because our medicines are there to treat an illness. There's not too many medicines that keep you healthy. Okay, there are not many medicines that keep you healthy. What can keep you healthy, however, is engaging with what we talked about, the physical exercise, the proper sleep, the simple things. These are very, very simple. Fluid intake, water intake, to keep ourselves mentally fresh. That is what keeps us going into the future.
Yeah, I'd agree. I think, you know, what we're also seeing is we work with a number of organizations who are looking at ways to look after their staff. And so this is employer health services. The interesting thing that we're observing is when we first started working with these large employers, it was all about physical health. How can we get our teams and our staff more physically active, more aware of the behaviors that are perhaps impacting their physical wellness. But in more recent years, that conversation is much more balanced between physical and mental health. Now, lots of employers are very concerned about workplace injuries and people getting hurt at work. The interesting thing that many organizations around the world are now starting to consider is particularly around mental injuries, and what is an employer's responsibility for a mental injury which may or may not show up at work, and how impacted has that mental injury been by their lifetime of experiences that have got perhaps nothing to do with this particular employer. So almost the accountability for an employer is going up in terms of looking after a person's holistic well-being. And the more progressive employers that we work with are actually saying, we don't separate home from work. We don't separate physical from mental. We're just here to look after you so that you can do the very best job and you can have the most rewarding life. It is an emerging area of corporate health. And it's tremendous to see is that organizations are starting to take on a greater role and a greater accountability for an individual's all of well-being.
Yeah, certainly. And so with that, we've touched a bit on, I guess, you know, stigma and the changes in that in the corporate world. And then, of course, we also often talk a lot about changing the stigma with mental health problems with people in the public and getting them to understand that their mental health is just as important as their physical health. But I do have a question regarding within the medical profession, and perhaps Peter, you might have an answer for this, is regarding not only stigma towards mental health within the medical profession and, you know, within hospitals, etc. themselves, but also as well then for people who may have had experience with mental health issues, but then also have other underlying long-term conditions, particularly invisible conditions such as POTS, OI, chronic fatigue, you know, a range of other ones, and how you think, I guess, that stigma and potential dismissal of mental illness might result in, I guess, a lower quality of care for their physical conditions and so forth. That might, as a result, get taken less seriously due to that perceived correlation between that and mental health.
Look, Adela, you make a lovely comment there, and I think it's a very, very valid point. Unfortunately, you know, I mean, my eyes typically are skewed towards acute medicine, so I deal with a lot of acute problems in hospitals. But again, I don't have the feel in terms of general practice and primary care. I guess that's where a lot of these conditions are managed on a day in, day out basis. But yeah, there has been, and I've seen it throughout my career. I've seen it through my career, labels, stigma, mental illness, and perhaps detracting from opportunities to investigate things more thoroughly, or to actually look for underlying causes that might be contributing. And that's where I think we've been let down in the past, whereby we might classify somebody with a condition, stigmatise them as, oh, look, that's just a mental health condition. They can go and, see psychologists, psychiatrists, I'll sort it out. But that's the danger here in doing that. And that's what I like to say to all my patients who come to me. There might be symptoms of anxiety, of course, but you never just say to the patient and dismiss the patient based purely on, those symptoms. You can never ignore the symptoms. You ensure that you seek advice about any symptom that you have. And it's amazing that all these symptoms that physically occur are never in our mind. But patients will come and say, look, doc, it's in my mind. I'm sure it's in my mind. I've been feeling these flutters in the chest and I can't sleep at night. No. That's what we can do as professionals, to say, no, it's not. We're not going to stigmatise. We're not going to put you in a little basket and sort of say this is mental health issues. We're going to actually solve the issue. We're going to work together. We're going to say that it can be challenging to work out what's going on, to decipher what is actually coming from A and from B. But we have to work together in partnership, and we have to solve it over time. And hopefully, and I'm seeing things are improving slowly, but things are definitely improving in the way we are progressing in medicine and the way we're managing our patients.
Certainly, yeah, definitely. And that's a great point that you make as well about things never, I think when people, do have that idea that maybe their physical health has been influenced by their mental health, that it's all in their head or they're making it up. But it's a great point that you bring out that, if our mental health is creating those physical symptoms, that's still a real thing that we need to address and needs to be taken seriously.
That we need. There's been a comment put up there from the audience saying that one of their relatives had some chest pain, and again, we never dismiss any chest pain. Now again, the most rewarding part of my job as a cardiologist is in the majority of my patients, I can tell them, look them in the eye and say, your chest pain is not coming from a heart problem, and that's the most rewarding thing that I can do. But it means that I've actually done some preliminary investigations to ensure that things are not non-cardiac. So again, always best to speak to your local GP and to just follow up. If you're not satisfied, keep asking the questions. I think we've got to take a proactive approach in our health and ask the question again and ask about potentially having some simple investigations to ensure that there's nothing underlying the symptoms.
Certainly. Thank you so much for that. Now we've just got a couple more questions before we'll finish up. This one, I imagine, is directed at Mike. Your treatments are about empowering the individual to self-manage via education. Do those you see maintain the motivation over time, or do they relapse and have to start the learning all over again? And additionally, Peter, as well, if you have anything to say on this.
Yeah. So, low intensity cognitive behavioral therapy, motivational interviewing, etc. These are all very common techniques to help improve someone's health literacy. Health literacy is shown to be one of the major predeterminants for poor health outcomes, because people just don't know what they don't know. And in many cases, it's the first time that they've experienced this chronic disease or this particular health condition. So it absolutely is a program of helping someone to self-manage and ultimately putting the accountability on the individual to make changes to their lifestyle, their diet, modifying their diet, exercise, sleep, nutrition, etc. All these elements that are what we call modifiable risk factors. So when you're trying to change behavior, of course, it doesn't happen overnight. It's not a switch that you flick, because behaviors are built up over a lifetime and over your psychosocial upbringing. We have many people who are in our programs that have very limited understanding of what a healthy diet is and what it should look like. And as Peter showed, the plate of a balanced diet, that is often very foreign to a lot of people, particularly the one that says vegetables should be the greatest portion. So modifying people's behaviors is a journey. We are very fortunate that we have relatively low relapse rates, but of course we do, and that allows us to then re-engage with individuals and go, okay, so you learned 8 out of the 10 things. What are the 2 things that you're still struggling with, and can we work on those quite specifically? But like anything to do with lifelong learning or anything that's behavioral, it takes time to make change, and change doesn't happen overnight, and it's difficult to undo things that you have learned in the past. But it can be done, and there is huge evidence that shows that it is being done, and that these sorts of services make a material difference to people's life for the rest of their lives.
Certainly. No, that's really great to hear there about that. And, it's hard work changing those behaviors. So it's great to hear the persistence there with ensuring that everyone is able to make that change and improve their health. The last question for the event today will be, could you please suggest ideas for what a mind wellness rehabilitation program would look like? Mike, you've already touched a bit on what your program's looking like, but also as well, perhaps Peter, you've got some other ideas as well.
I patent that idea, I think, the mind wellness rehabilitation program. Mike, I think we should have a chat.
Well, we should have a go at it. Yeah, this one over here is not a bad start. So, I mean, it is based on.
You see what I mean? About the issue of you fracture something and you go and have rehab. You have a heart attack, you go and have rehab.
Yeah,
you have depression,
that's right.
You're in hospital, and you go out and speak to your GP and psychologist, and you're left in at home. And why not have a rehabilitation service, a program to encourage the factors, all what we talked about today.
Yeah, I mean, physical rehabilitation, as Peter highlighted, has been a well-worn road. It's actually a lot of what we do as a business. We do a lot of physical rehab in the home, and really the emergence of hospital in the home, in its broader sense, is really coming alive at the moment. And mental health is one major area of reform that I think we will see, particularly coming out of the private health insurance reforms that are coming out later this year or early next year. That this focus on mental health in the home is definitely an area that can make a huge difference in terms of rehabilitating and keeping people living independent and well for longer.
Yeah. Certainly. And it'll be great, hopefully, in the coming years as we go through all this reform, to see even more programs like yours, Mike, spread even further, so that way we are able to even just have more awareness about programs like Australian Unities that exist to help people rehabilitate their mental health. Because even if the services are there, if people don't know that they are there, it can be quite hard to access those. So on that note, thank you both so much for speaking today and teaching us all so much. It's been such an honor to hear from you both and hear your insights into this field and this link between physical health and mental health. I would also like to thank everyone who's attended today's event and been watching. I extend my thanks to the board of Mental Health Foundation Australia, who have also been listening in, and Vasan Srinivasan, the chairperson for the Mental Health Foundation of Australia, who has also been following along. Particular thanks, of course, to Professor Peter Barlis and Mike Hutton-Squire for all your insights today. We do have engraved pens for you both as a thank you gift. Of course, I do not have them with me now in this wonderful pandemic world. They will be delivered to you eventually. We can't control how variable the post will be, but they will get to you. So on that note, thank you so much for your presentations today, and thank you everyone for attending, and I hope you enjoy the rest of your Thursday afternoon.
Thanks very much, Adele. That's great. And I think people are asking for the slides. I'll put up the slides on the Heart Matters website, heartmatters.net.au, on the YouTube channel. You'll find them there. Thank you.
Perfect. All right. Thank you so much, everyone. Farewell.
Bye-bye.